में क्या वो शामिल है क्या वोट कब वोट हाउस बात करता हूँ अबरार से
Non-invasive ICV monitoring can be done with transcranial Dopplers. We can see the flow velocity in middle cerebral artery. Tympanic membrane displacement recorded by tympanometer. ECG can be helpful in depicting the deciding the use of cerebral metabolic depressants. Future technique under trial is transcranial acoustic transmission assessment, which can be recorded by pressure tympanometer. So medical management is, as you all know, raise the head into 30-degree, analgesics, proper analgesics should be used, sedation if required, and treat the predisposing factors which can raise the ICD. So hyperosmolar therapy, mannitol, we all know, hypertonic saline, barbiturates use is controversial and steroids is non-significant. Brain Trauma Foundation guidelines 2012 have shown a different level of evidences for different interventions and monitoring techniques which should be followed for cerebral perfusion pressure, and unilateral or bilateral can be done as required. Brain Trauma Foundation guidelines have suggested the protocol for pediatric brain injury management which should be followed in all the centers. Discharge should have a special protocol, and the patients, when the patients are discharged, the checklist should be there. If there is increasing headache, persistent vomiting, restlessness, drowsiness, patients should be brought to hospital. To conclude, diseases 8 or less should be mandatory for timely intervention to reduce morbidity and mortality from head injury in pediatric population. Thank you.
Sir, in your place?
In Western countries, they are very common, but in our country, I didn't find many cases. Maybe, I think, less than 1%.
You should suspect in some cases.
Yeah, we have the suspects in some cases, and if there is any suspicion, they should be observed.
Thank you.
I've seen it.
Our next speaker, Dr. Adi Sarmast, he will speak on endoscopic third ventriculostomy in non-communicating hydrocephalus and experience at SCIMS.
Thank you very much, sir. ATV is a technique to treat non-communicating hydrocephalus, and it involves making an opening in the floor of the third ventricle to bypass the obstruction of the space. Due to any obstruction, one of the common obstruction being at the neck, the ventricles get dilated. What is the plan in ATV is to create an opening in the floor of the third ventricle. We bypass obstruction and allow the CS. Elimination of reliance on mechanical shunts along with their inherent limitations. So we are trying to maintain the CSF flow in the precortine system. The flow dynamics are essentially normal in patients, better light transmission. The only disadvantage is that it is not steerable. Acquired acral stenosis tumor obstructing the CSF flow are the indications where the success rate is very high, more than 75%. And patients with previously shunted, this must be known. The aim is to pass an endoscope through the opening, reach the lateral ventricles, the foramen mono, reach the floor of the third ventricle, and create an opening just in front of the mammary body and behind the infundibulary recess. The important structure beneath is the mammary, this is the vesical artery, which we have to take care that we do not puncture it. Mr. Photographer, come to the side. This is the foramen mono. seen by anterior septal vein, the thalamus straight vein, and the choroid plexus. The amalgamation where we localize the foramen modular. This is the choroid plexus, anterior septal vein, and thalamus straight vein. We go through the foramen modular and will localize the floor of the third ventricle. In relation to the procedure outcomes, success and complication was noted. The patient of cerebropontine angle, there were 6 cases, and out of 6, all the 6 who had we were able to do the procedure successfully. And out of 6, only 5 remained shunt-free. In one of the patients we had to reintroduce, we had to place a shunt because we were not able, there was a stonal block after 1 or 2 months, and we had to introduce a shunt in this patient. So it was taken as an ETV failure. Patient of posterior, all the 7 met successfully, 1 patient has CS of leak. There was 1 patient of posterior ventricular fan failure. There were 4 patients. After them, we were able to complete the procedure only in 3. So there was a primary ETV failure in 1 patient, in which we were not able to identify the floor of the third ventricle. So we abandoned the procedure and placed a shunt in this patient again.
The cheek ventricle, which are so we normally see when the shunt is placed, with the patient is calm, the patient is improved. In ETV, the radiological improvement will not follow. That is what's the point to be understood. There's another patient. He had hydrocephalus, minimal hydrocephalus, but symptoms were there was headache and vomiting. We did an ETV in this patient. He improved. Thank you very much. So special thanks to people without whom this was not possible. Thank you.
No, it's at the site of injury. We are just talking about the adjacent to that injury, just proximal or distal to that injury. There is some vasospastic conditions there. Definitely is there.
Maybe, I am not sure. Huh? But to me, it looks like vasodilatation. Okay.
I want more comment. I'm since like 8 years I'm doing laminectomy and duroplasty, and I think laminectomy alone in acute spinal cord injury is not helpful too much if compared to laminectomy and duroplasty.
Spinal instrumentation and management. This talk will be divided into complication of spinal instrumentation and also management of the spinal implant. Spinal fixation device can be used to form a rigid construct to the spine. Replacement is a bone defect, correction of deformity, restored alignment, maintain the position, prevent motion in the treatment site like fracture, degenerative neoplasm, and congenital deformities. Complication of spinal surgery may be difficult to diagnose and manage, and it is frequently difficult to identify the causes of persistent or recurrent symptoms on clinical ground alone. Failure sometimes, cardinal symptom of the failure of spinal fixation is the pain and or neurological deficit. So this complication can be divided into general complication, which can be in any spinal surgery, and the local, like nerve injury, dural tear, bleeding, infection, implant failure and fusion, pseudoarthrosis, instrumentation, and transitional syndrome. The non-mechanical cause of post-operative symptom like hematoma, the acute onset of neurological symptom in the immediate post-operative setting should arouse clinical suspicious about it. And it can be easily identified by the MRI. The infection is a complication that may not be manifested until much later in the post-operative course, even more than 2 years after surgery. The deep infection, including discitis, may be difficult to diagnose. Radiological observation with discitis classically show a collapse of the disc space in the plain X-ray, destruction of the tissue in the blade, and evidence of osteomyelitis in the adjacent vertebral body. The deep infection, which includes discitis, isotopy scan, label, white label blood cells, and MRI imaging may be useful for confirming the diagnosis. This collapse of this space, destruction of the tissue in the blade. And this is an example. Osteomyelitis can be identified by the MRI and towards neurological complication. Also, to discuss this, there will be destruction of the body. MRI progressive in the blade destruction, collapse of the disc space, and also being symptoms that arise over the long term may be due to uveitis. You have to put it in your mind. This is an example. Radiography is an of cross leg. Medical deviation of the ventricular wall, violation of the ventricular wall leading to vessel complications. This is in thoracic, too long screws. An example is can be identified by a ring of translucent around the screws threaded, like in the CT, and is easily to be identified. Adjacent hand segment degeneration, which is coming now with this example was compression of the cord. Also, the ligamental instability following multi-segmental cervical fusion, lateral flexure radiography demonstrated lead to solution of ossifications and despair. The vessel patient selection is very important, coupled with obesity, and it was technical difficulty.
सुबह तक जून थोड़ी देर बात करना चलो नंबर 3 का प्रेसिडेंट है सुनो भैया हाँ बबुल को बुला दो भैया यहाँ पे अब इधर जिला में वो वाइस प्रेसिडेंट
If you agree this quorum is complete, then we proceed.
Quorum is complete, we can proceed.
If the quorum is not complete, there is a way.
We have to again meet after, I know that.
After 2 minutes.
That's what I said, yes.
Quorum is not complete. So let us meet
Quorum
after
इतना ही
2
रहेगा,
minutes.
सब लोग घूमने चले गए.
Good academician and a very good surgeon. And the best part was, all patients who ever visited him were pleased with his manners and his way of treating. It was very untimely that we lost him. He started losing weight very fast, nobody knew, and it was December 14. He got a ultrasound done to find that he had multiple metastases, and despite best treatment, we could not save him. So we observe a minute silence as a mark of respect to Dr. Sinha.
Okay.
Last year's GBM we had first agenda was to decide if we can ask distinguished neurosurgeons to present a paper at the conference without being a member. The other was.
No, but you are telling secretary.
I'll come to it. Okay. So we had meeting in Indore last year in February, and after that we have added 79 new members during this period, and 35 new members have been added during this 5th annual conference. So the credit goes to Dr. Ramzan for motivating people. So at the moment the strength is standing to 677, if I stand correctly. Is it 677?
677.
And these are all live member or what?
No, we got the allied members also.
They are live
associate members also.
This includes associate?
Associate as well as.
Okay.
How many associates?
Sir?
How many associates?
We'll have to break up. I can't
take some time.
Okay. Yeah. During this period.
हमारे पास जयपुर में बन गया था. यहाँ पे और सुविधा आएगा उनको मिला करके. वो मेरे पास भी है नहीं information.
At Apollo and multi-speciality center trainees. This will be on 14th and 15th of May. Yesterday, the first was to decide if we can ask the distinguished Indian neurosurgeon to present paper at the conference without being a member. Yeah, because he has to renew his subscription every time. If he wants to become a life member, he can pay the remaining due.
Being held at this very venue. NSSI has been the platform where those great minds in the neurosurgery have interacted and they have progressed. The knowledge sharing has happened. We had some gruesome sessions yesterday, today. May I have the privilege to call on stage Dr. Tetsu Kanu, before the 5 minutes. Please take a seat. Brilliant admission. Dr. A.K. Mahapatra, to take a seat. Dr. M.K. Tiwari, the cornerstone for the conference. Take the stage.
My home place, where I'm
And Secretary, Dr. Arwani.
East Coast. Dr. Rajkumar is another director of the
Book is on presented for dignitaries. The fresh aroma and fragrance will lighten up the mood.
आपकी तरह मिल तो जा रहा हूँ साइड में कितना साल तो मैं स्टेज में बैठी हूँ
Students in the topic workshop yesterday who told me when he had been offering a beautiful scene from a window, he told me that you look at the parade. The accuracy is very far away from this. Great point others coming us. That means if there is her and it's there. I'm sorry but I never been an opportunity to praise my motherland. Without wasting much time, we move on to the felicitation part, which is all which I humbly request our worthy director, Sher-i-Kashmir Institute of Medical Sciences and Executive to felicitate the chief guest of occasion and President GIMCO, Dr. Tuso Kalon, who is from Japan.
Thank you.
Next.
Ah, for okay, thank you. Yes. Okay. Hello. One is for my wife, maybe.
Yes, it is bisexual. Anybody can use it.
He made the skull-based society single-handed.
Treasurer Ajay a big applause to Professor Abdullah.
So,
Organizing Secretary Dr. Abdullah. Thank you, sir. But somebody while shaping this program told me that Hazrat Sahib is not diet. God bless you, sir. Will be released by the dignitaries of the dais.
Good. चीफ गेस्ट को पहले देना चाहिए करवाना था चीफ गेस्ट
Thank you very much.
Thank you. Without wasting much time, I request Dr. Abdullah Maranatha to organize the chairman of all of
guests on the dais. At the very outset, I would like to pay my condolences to one of our colleagues, Professor Sanjeev Sinha. He was a professor and head department of neurosurgery in Chikipal Hospital, Delhi. He had an untimely demise in August last year. So we have lost a very humble man, a very humble soul. He was a great neurosurgeon and a very humble person. So, in respect of Professor Sinha, we would observe 1 minute silence. We will all get up and observe 1 minute silence. I welcome you all to this beautiful valley of Kashmir and in this beautiful weather. I hope that we have made proper arrangements to keep you all happy. I know Dr. Abrar has worked very hard along with his team to make everybody comfortable in this place. But still, it's not possible to keep everybody happy. It's not possible to reach everywhere. It's not possible to remember everyone. So if there are any lacunae, I'm here. I'll take all the blame. And I hope that you will apologize me. I need an apology if there is any skip or any failure from our side. This event is basically an academic event, but we try to make a little bit of social, we want to give a social touch so that when you come from different places, you should have an interchange and interactivity with different cultures. And I hope that we all have mixed with each other, learned certain things from the others, and in fact, today we learned a lot from Professor Kanu. The best thing that we learned is that we all should treat the patient and not the disease. And this is my message now conveyed from Dr. Kanu, and now I am also again repeating the same, that we should not attack the disease only, and we have to look after the patient and look after the social problems of the patient, the economic problems of the patient, and not as a disease alone. So with this, I welcome you all again and hope that your stay will be comfortable in the next few days. Thank you.
Dr. Ramzan and Dr. Abrar, who have selflessly and untiringly worked for 365 days, and the result is that such a good conference was organized by them. It was a pleasure to be here in all aspects. The scientific contents, probably this is the first conference which has a maximum number. I think the number is around 90 people, if I'm not mistaken. It is more than 90. And all praise goes to Dr. Azhar. I thank you all for coming here and sharing your scientific knowledge with us and blessing us. With these words, I hand over
to Kanu, well-known trainer of Asian neurosurgeon, guest of honor and father of neurosurgery of Sher-i-Kashmir, Brother Kashmir, Professor Afzal Bani, my own great teacher, Encyclopedia of Neurosurgery, Professor A.K. Mahapatra, Principal and Dean of Custodian of Skims Medical College, Dr. Shaukat Ali Zagar, other dignitaries including Professor Altaf Ramjan, my favorite student, Dr. Avraj Ahadwani, Professor Manoj Tiwari, Dean of the Institute, dignitaries of the dais. I can see Deborah, Professor Hossam, Dr. Jaleli, Waznik, other seniors, dear faculty members, residents, students, family members, and people from press and media. Well, let me congratulate first the organizing team. The team has done a wonderful job while organizing this conference. Good in every aspect. I am hilarious to be here. Be it the taste of taste buds, that means cuisines, be it the scenic beauty, be it the lush green herbs and shrubs, the ice-laden hills, the beauty of organization, beauty of welcoming, everything was wonderful in this event. I don't know shares, but I cannot stop myself at this juncture. This came just immediately in my mind. You can understand the meaning. It is in Urdu. मुंतहिर का मतलब एग्जामिनर होता है. मुंतहिर मीन्स एग्जामिनर. अगर मैं मुंतहिर होता तो नंबर 100 में 100 देता. अगर मैं मुंतहिर होता तो नंबर 100 में 100 देता. नजाकत के अलग देता, नफासत के अलग देता. I am grateful. NSSI is grateful for such a wonderful organization. Credit goes to the Professor Altaf Ramjan and Dr. Abrar, who have relentless efforts in organizing this team. It would be appropriate to have a big round of applause in order to compensate their sleepless nights. Well, as an NSSI president, I have certain obligations for the society. I would like to spell out few of them. Ours is a new body. This country did not have the forum for the neurosurgeons. Ours is a mammoth population in this country, and the neurosurgeons are very scarce in number, counting only to 2,000. You can understand the neurosurgical problems cannot be addressed by merely 2,000 neurosurgeons of variable standard, variable training, and variable qualification. It's a great irony. NSSI has taken a task during last 5 years that the training somehow, by some modality, by some method, by some way, the training should be brought to a level so that an optimal standard neurosurgeons can be trained in this country. With this continuity, NSSI had been organizing different courses all over the country in order to offer a good training to the trainee neurosurgeons. The big challenge is ahead. This is for the consumption of the people of press and media if they are here. In days to come, the trauma is going to be the biggest killer in this country. See the irony. Every minute this country has one accident. Every 4 minutes, one person dies on account of accidents. 1 million people every year have accidents. 1.5 lakh people die. And I don't know how many go to the morbid conditions. Can you imagine? In a country with mammoth population, with meager number of neurosurgeons, can this problem be addressed? The NSSI is working hard. And I request by the people from press and media that it is an appropriate time and opportunity and probably a mature time with this country, including institute, including the state of Jammu and Kashmir, need to build up the level 1 trauma center as soon as possible in almost every state in many bigger towns. Otherwise, this is going to be devastating in days to come. But they are not running the way we should run. Not only this, the time has come, etc. These spinal cord injuries are devastating, crippling conditions. Patient is fully conscious. The flies are sitting. Something needs to be done by policymakers, by administrators, by press and media. They should come together. First leading cause of the death. Forget about the myocardial infarction, cancer, death. And we need to have good neurosurgeons. We need to have quality neurosurgeons. We need to have a team to cater the trauma in days to come. This is a problem which is faced by this country is the pollution. You know the oxygen reports from Delhi. Somebody said that it seems as if somebody is sitting in the chamber of carbon dioxide. Deforestation, because of industrialization, because of advancements, because of it, we have done too much deforestation. And do you know that today we have one plant, this oxygen problem is going to suffer our brain. Brain is the master of body. Whatever is you are seeing in this universe is just on account of the brain, just on account of the thought. When we will have to work with probably oxygen cylinders, if we do not inculcate the habit of avoiding deforestation and implanting more and more trees, forget about the state of which is suffering very much, particularly in neurosciences. Even China produces more. They produce the research by multiplication factors. Otherwise, we will get a defect. We study how to take critical experiences, and the institutions and administration will have to take the lead on this field also. Otherwise, it's a first. And in days to come, we would be trying to cater few of the problems.
And maybe these will see the light of the day soon. And we hope you are Muntaher every time and we get 100 out of 100. Come over here and speak about us.
On one hand, he said there are 10,000 neurosurgeons in Japan with a population of 100 million. 10,000. There are about 10,000 CT scans in Japan. About 500 MRI. So I was looking at our own country, why do we stand? But he concluded his speech by two beautiful slides, I think which was a message for all of us, how a doctor should be humble. I think what Professor Altaf said while he was speaking here, he said, I regret at the end of my life just to see whether I have treated a patient for the disease or I have treated the patient for the patient. And he said, I think I regret that we all should treat the patient not only for the disease but as a whole. And second important thing, that was his own teacher, a super neurosurgeon. He said while he was operating, that the degree of humility that super neurosurgeon of that time was being his teacher also. He would always, once he would open the brain, he would ask the brain, can I use knife on you? Am I allowed? And then he would say, being a super person, that I am an average neurosurgeon. I think that was something. And what the conclusion was, we should be warm enough to treat the patient. I think there were some prophetic messages, which at least I take prophetic messages. I think what a doctor should be. So today we are grateful to you, sir. You are with us and sort of gracing us here. And I am also very, I think, grateful to him that he agreed to have a sort of a MOU with the Institute of Medical Sciences to train our people, to upgrade their skills. I think we should be all grateful and we should check. here are the guys, Dr. Abdul, whom I know since I joined the institute in 1982. He was a very different doctor. I would not say he was conventional, he was unconventional. He always looked in the reverse way. Suppose while I was a student, it was mentioned in our Lawrence pharmacology that nitrates are contraindicated in myocardial infarction. But today, and somebody will be prosecuted in the United States if you use nitrate for MI. It was a story in 70s. But today, if somebody doesn't use nitrates, he can be prosecuted in MI. So he's a with 35, I think almost 35 years. And today we are proud to have a very beautiful, excellent faculty who have been trained from the prestigious institutions of this country. And we have almost, I think, 7 trained universities right now. I think we have at the dais Dr. Rajkumar, who is the director of one of the AIMS. Then I know Dr. Mahapatra. I know him personally. I think Dr. Rajkumar said he's an encyclopedia of neurosurgery. I don't believe that. He's an encyclopedia of everything. Whether it's the politics, it's a social life, you want to know the history. Amazing memory, I would say. I have seen one of the doctors in my life. And I think I know, because I am associated with him for AIMS, how he has developed that area and how he is motivating people. And I think that college has come up, MBBS is there, they have already recruited the faculty, working very hard at this age. And not only that, before that, I think you must be all knowing, he has been also the director of one of the prestigious institutions of the country, as it is here. Thank you very much, sir, for coming. I think we have also the guys, Professor Tiwari, who has been the secretary. I think he was very brief. I wish all of us would be brief always like that. I think it needs a lot of talent to be very brief in the meeting. And Professor Guljavi, who is our beloved dean, making all efforts to have the academics of the institute in a very big way. Then Professor Altaf Ramzan, who followed Dr. Abdul Wani. And I must tell today, observe, you should feel very proud of him, because he has taken department to very different heights. Which is, I think, one thing, not only that included patient care, but I think has taken the department to different levels. In academics, I personally believe there are more than, every year there are about 20, 30 beautiful, I think, high impact publications in the journal, and they're written the books. We have Dr. Abrar, very silent worker, dedicated and committed to the job. He's a profile writer, I know very well, and always available for the patient. I think he has a great qualities of a very good doctor. I wish him, he should continue to be like that humble way. I don't want to say much, I think, I don't want to take up much time, but I would say that the neurosurgery, like other sciences, has evolved quite a bit. And we're also doing a bit in the Institute of Medical Sciences. This young team of 7 trained neurosurgeons, they are doing wonderful work. And not only that, they are also contributing to the creation of the human resource for the state. Because it's the only center in the whole state having a population of almost 12 million. I hope that there should be more and more centers. And they are producing MCH regularly for the last 7 years. And I think they are doing almost everything. I presented their work once in a governing body, which was very impressive, the endoscopic work, the brain tumors and different vascular work. But I think they are lacking 2 things which they have to compensate. One is the gamma knife. Hopefully, I think I've got a money for it, we should be able to get it. I think Dr. Abrar, Dr. Nai, they have been already trained for it before the lab has already started. And I am hopeful before surgeries every day. I am certain in our institute there must be, I think, at least 20 craniotomies done, 15 patients, I am certain about it. And I think one good thing what they have done, I think Dr. Ramzan under him, they have diversified. I have to sell my baby because neurosurgery, that's why I'm talking about neurosurgery mainly. And I think I'm grateful to all, and also highly grateful to international community. Kashmir is a peaceful. You just carry this message that please visit this place. Because I'm certain, I don't know, I was asking Dr. yesterday, have you made something like good for them? They should move around. They should not do only science. They should do pleasure also. And I don't know how many of you have gone to places that are very nearby. Thank you very much.
I think there are appreciations everywhere around. Thank you very much. I am extremely delighted and feel proud to be part and parcel of prestigious Sher-i-Kashmir Institute of Medical Sciences. SKIMS, as it's commonly called, is committed to patients of Jammu and Kashmir in particular and country in general to provide super specialty tertiary care facilities and treatment to those who happen to confront with day-to-day emerging complicated medical and surgical problems. Besides, SKIMS is enjoying the status of a deemed university from 1983, and since then we are actively and steadily involved in imparting the quality education and training to the aspirants of the highest standard in different disciplines of medicine, surgery, and laboratory fields. As Professor Rajkumar rightly said, the development of neurosurgery in India during the past 16 years has almost paralleled the achievements of the country in 69 years of freedom. There were neither trained neurosurgeons nor any department of neurosurgery in India at the time of independence. A few general surgeons were performing neurosurgery at that time. All heads of the surgical, medical, and basic science departments considered neurosurgery and neurology and its ancillary neuroradiology, neuropathology, neurophysiology, and neurochemistry irrelevant under the circumstances. It was a continuous struggle of our seniors to rid of this controlling yoke. Over the years, there has been a tremendous change. Neurosurgically treatable diseases are now diagnosed and referred in good time. Many ancillary diagnostic facilities are now available, and the patients themselves are aware of the need to seek early neurological consultation. Neurosurgery in India is now at par with the best of the services available in the world. All necessary technological advances as well as qualified personnel are available in the country, though the centers of excellence are based in major metropolis cities of the country. Access to these services is now easier than before. And Professor Rajkumar rightly pointed out that they are not available in the peripheries, but still they are available in the main cities and major centers. Assimilation and application of technology advances has been at such a rapid rate that many centers in India are at par with similar ones above. The Department of Neurosurgery at Sher-i-Kashmir Institute of Medical Sciences was established in 1982 by the renowned neurosurgeon Professor Mohammad Afzal, who is sitting in the dais and is our beloved guest. The department was established with the purpose to develop and provide tertiary care to patients with neurological disorders needing surgical management. It was also required to develop an infrastructure for management of neurosurgical trauma, including road accidents and gunshot wounds, which has become a major health problem in the state of Jammu and Kashmir, as well director rightly pointed out. The other objective in establishing the neurosurgical faculty at SKIMS is to impart training, teaching to undergraduates, postgraduates undergoing surgical training, and also to establish a teaching program for the super specialty of neurosurgery. The department was established with a view to organize research on neurological disorders prevalent in the community. All the procedures which are carried out at SKIMS, Department of Neurosurgery, are being performed with equivalent success, and results are par with prestigious institutions of the country. The department has made strides with great success in neurovascular, that is aneurysm surgery, transnasal microsurgery, pituitary tumors, spinal inflammation, CBD, cervical, dorsal, as well as lumbosacral. The department is active in establishing bedside and innovative research protocols. The department is also very active in literature writing about innovative research protocols. And the department has up to this time produced 10 papers in 2015 only, which were published in journals of repute. The department also actively involved in telemedicine interactive teaching program with various major centers in India. At the moment, the department is running 6 OPD clinics per week, 12 major operation theatres per week, and admit approximately 20,000 patients every year needing active neurosurgical management. The department performed a total of 577 elective surgeries and 800 emergency surgeries in 2015 alone. It has been a policy of our worthy director that besides neurosurgery, various subspecialties have been developed as guidelines as per the international standards. These include pediatric neurosurgery, stereotactic surgery, functional neurosurgery, epilepsy surgery, skull-based surgery, intervention radiology, and spine surgery, and a full-fledged department of neurosciences. And I think this is the diversification is the buzzword. Take up one idea, make that one idea your life, think of it, dream of it, live on that idea, and let the brain, muscle, nerves, every part of it be full of that idea, and just leave every other ideas alone. This is the way to success. And send love them anyway. If you do good, people accuse you of selfish, ulterior motives. Do good anyway. If you are honesty and frankness make you vulnerable, be honest and frank anyway. What you spend years building may be destroyed overnight. Give the world the best you have anyway. Success. God bless all of you and God bless you all. Thank you.
Welcome all my friends. Suresh is there. The 3 great friends who I have for neurosurgery is Dr. Karnal Sahu, I saw him, then Dr. Rajkumar, and of course Dr. Daljit Singh, who have really put neurosurgery on the academic map as MCI, and my great friend Dr. Badoi is there, who is the additional, he is the, what you call, neurosurgery is dedicated to the young residents. When I came here, and Dr. Babu was there, Dr. Peshan was there, and Mr. Tariq Jalu was with us. So we started our work, and I remember the anesthetists, mostly residents who had come from PGI, we all sat together and never looked back, started from 12 beds, and neurosurgery became the largest specialty in scans. We used to take care of 20% patients of the hospital. And my great friend Ashraf is here, as well as Yusuf, who was lost in neurosurgery in Kashmir, but he was great help to the world neurosurgery as well as Ashraf in England. Now I have lots of memories with the people who have been abroad with me, and they are here. Maybe I missed some people. So there's really not much to say. The turning point in my life was 1970, when I passed out from MC with Dr. Kundu. We both joined the armed forces. We did the training together. Then I joined the paras. My luck took me to, instead of PVG and Gangotri, I went to AIMS. And it was nice, Dr. Nandi was there. He trained me in surgery, wanted to become a gastroenterological surgeon with a job in St. Mark's and Hammersmith in Britain. But I turned out to neurosurgery because somehow I got mesmerized with Professor Tandon, Dr. Banerjee, and I took neurosurgery and never looked back. There was option for me to be in Delhi at GB Pant in Safdarjung, where I worked for some time, but then finally it was homecoming and I was alone. I was lucky to have Dr. Babu and Dr. Peshin, so we started with Dr. Sushil Razdan. He was a neurologist. We did a conventional radiology, angiography, ventricograms. We had got some shunts from Delhi, and then we put in our own implants on patients. And that's how neurosurgery started. So the most important thing is the residents we had. The initial residents were Dr. Gulzar Haru, who is in Britain. They're great, God bless them. They never, many times got angry with them. When I would leave hospital at 7, they would be at the gate. They said, "You're going now, who will take care?" So they would go back to the hospital. So neurosurgery is dedicated to my residents, who are in their own way great surgeons today. So, we have two neuro teams now. One is the parent team, one is at the GMC. Some people have moved on to Jammu, some people have moved on to Delhi. We were 3, and now we are more than 50. And Manmohan is there. Welcome to Kashmir. And we work with neurologists. And I'm so grateful to Dr. Shaukat Saab, who gave us his first ultrasound gastroenterology. We did our first brain endoscopy in 1986 with Kuru Saab doing with ultrasound biliary endoscope. Yes, on a hydrocephalic child. We never took, Mubashir did an endoscopic thesis with Rimlan Saab, endoscopic discectomy. So endoscopy has been a very old idea with us. Stereotaxy started in 85, 86. So we got diversified, but we have to keep on with general neurosurgery. And Dr. Tandon once wrote a letter to me from Delhi. The traffic from Srinagar has totally dried up to Delhi. And then he came and we lined up the years, patients were done for 2 years in the corridors extending from ICU to the neurosurgery ward. And they were all waiting for this great man to come and see the work we had done. Anyway, now the situation is different. We were not lagging. All the PGs came from surgery. Everybody had a neurosurgical thesis. It was bedside work. It was experimental work, ISP monitoring done in 80s. Everything. We used an ultrasound, courtesy radiology department. I used to push the ultrasound, Aloka type, to my theatre. And we did ultrasounds in 88, 89. We had a symposium on acoustics here in 89. When all the great people in the world, Adlos, Al Roton, Ramamurthy, Tandon, Banerjee, Robin Sengupta, everybody came to Srinagar. And we had a great meeting in this very hall. And then the turmoil came, but we never left behind. In that turmoil also, we kept on struggling all through. And now the result is that we have a great conference here, which is headed by Professor Mahapatra Saab, and he's been a great friend of the Institute. I'm so grateful to my foreign visitors here, dignitaries, and I'm sure we learned a lot from them, especially Professor Kanu, who has become so humble. And he said, can I touch you, my patient? I am an average neurosurgeon. I think we learned a lot from him. And the young people who worked with us, now they are great surgeons and great physicians in their own right. Thank you very much.
Although I have been more than 10 times in India, but this is the first time to visit Kashmir. I established the Asian Congress of Neurological Surgeon nearly 23 years ago. Now, at that time, all the participants to this Congress used to be very young, at 23 years past. That means all of them, most of them promoted or becomes #1 leading neurosurgeon in each country. Or someone is working very actively in the World WFNS, World Federation of Neurosurgery. That's very nice for all the Asian neurosurgery. Anyway, you know that Kashmir is very, very famous among Japanese. I'm sorry, but mostly the name. It's not so often for Japanese to come here, but I really wish we develop our communication, not only neurosurgery, but also all of the part between the two countries in near future. And if you have a chance, please come to Japan sometimes. Everything is different, I dare to say, because when you eat something, you use a hand, but the Japanese use chopstick. But for neurosurgeon, young neurosurgeon, it must be a good training, to improve the surgical technique to use chopsticks. But anyway, not only neurosurgeon, we must welcome a neurosurgical nurse, particularly in this area, Kashmir, India. We have received several neurosurgical nurses to my department. They are #1 most beautiful nurses in the world. So we most welcome you. Please come to Japan. Anyway, if you come to Japan, most of the Japanese cannot speak English like me, but we have very warm eyes. We most welcome you. But anyway, thank you very much for the kindness. Thank you.
Professor Emewani, President NSSI Professor Rajkumar, Director SKIMS Professor Sher-i-Kashmir, and other dignitaries on the dais. It's my great privilege and opportunity. We have been asked to propose a vote of thanks on this occasion. And it's not easy to thank everybody, as rightly stated by my teacher, Professor Altaf Hamzan. But the convention is that we have to do it and we must do it. Try to do in the best form of it. First and foremost, I am thankful to Almighty Allah for His blessings that this function could be organized and connected in a smooth, hassle-free manner. I am so obliged that Professor Tetsukawa and Professor Emewani accepted to be our chief guests at this occasion despite their busy schedule. I must mention our deep sense of appreciation for the executive members of NSSI, who reposed a great trust in us when we proposed to them about holding this prestigious meet in the Valley. In this, I am especially thankful to my teacher, Professor Rajkumar and Professor R. Smithal, who so often encouraged me on phone and emails to carry on this project despite many odds, especially a couple of months beforehand, when there were some things that we might not even do this function in the Valley. I, on behalf of the Department of Neurosurgery SKIMS, NSSI, and my own behalf, extend a very hearty vote of thanks to all speakers, not only for gracing your important work and sharing with us your feelings and opinions today, but also for having traveled such a long distance to meet us. I could not imagine that all of you would be able to come here. When I imagine the globe from the far east from Japan and from the extreme other end US, our guests had to come. The guests who managed to come were from Egypt, Turkey, Ukraine, Japan, but unfortunately I am severely missing the guests from the United States and Pakistan who could not make it to this place because of their visa-related issues. I would like to take this opportunity to place on record our hearty thanks to Director Professor Shafat Ali Zardar and all the staff at SKIMS for their perfect logistic support and guidance. I also extend my thanks to the managers and the staff of the SKICC for their wholehearted support. Well, my dear friends, an event like this cannot happen overnight. The wheel has to start rolling quite weeks to months ago. In this, we have been fortunate enough to be backed by a team of very motivated and dedicated colleagues of a department who supported me in every respect. Right from our head, Professor Altaf Hamzan, to my fellow consultants and to other residents. And in this support, the names of my students like Dr. Sultan, Dr. Humam, Dr. Bashar, Dr. Arif, I cannot and should not forget. And one name which really, I should say that real appreciation from is Dr. Irfan, who really is the backbone of science. As we know, these functions need support financially, and hence I am thankful to all the sponsors, especially Mr. Mani Krishnan, Mr. Vipro Das, Dr. Adil Mirza, Mr. Mohit, Mr. Satish, Mr. Asif, Mr. Gawan, Mr. Ansar, Mr. Nasir, Mr. Hilal, only to name a few. Now, I cannot thank everyone for the involvement and their willingness to take on the completion of tasks beyond the comfort zones. Now, Mr. Chairperson, ladies and gentlemen, once again, I want to state that we are almost all grateful to all of you. We thank you for being with us with the same. Thank you very much, and pray that Almighty Allah bestows us with His best guidance. Thank you very much.
कौन कौन जाएगा
share a great experience.
ज़्यादा